Hello students. In our last lecture we covered introduction to inherited diseases, types of inherited diseases and single gene disorders. In this lecture we'll start with X-linked diseases. We're going to cover X-linked diseases and autosomal diseases. X-linked diseases, these are inherited traits that are determined on the genes of the sex chromosomes, that is X and Y chromosome. X-linked disorders are more common in males because they only have one X chromosome. As a consequence, males only need one copy of the altered gene for symptoms to occur. Example is muscular dystrophy. X-linked conditions are passed down in two ways: X-linked dominant or X-linked recessive. X-linked dominant means that one broken copy of a gene on the X chromosome is enough to cause the genetic condition. As we all are aware, men only have one copy of the X chromosome because they have X and Y chromosome, and therefore only one copy of all the genes that are there on the X chromosome. So in this case, if they inherit an X-linked dominant condition, they will be affected. There are several X-linked dominant genetic conditions that can be lethal to male. For women with X-linked dominant condition, they have one broken copy of the gene and one working copy of the gene. However, since only one broken copy of the gene is enough to cause the genetic condition, women who inherit a non-working gene for X-linked dominant condition often also show symptoms. Their backup working copy of the gene on the other X chromosome is not enough to make up for the broken copy because it is a dominant gene disorder. A gene that is located on an X chromosome that causes no transmission from father to son, but occurs from father to daughter, as all daughters will be affected since the father has one X chromosome to give. The father has X and Y chromosome. The X chromosome the father gives to daughter, and the Y chromosome the father gives to sons. So as the father can pass on the X chromosome only to the daughter, so the gene, if there is any defect on the gene that is located on the X chromosome of the father, so this disorder will be passed only to daughters, not to the sons. Children of an affected mom have a 50% chance of inheriting the X chromosome with a mutant allele. X-linked dominant disorders clinically occur when one copy of the mutant allele is present. We also in the last lecture that X-linked dominant disorders, especially dominant gene disorder, they require only one copy of the faulty allele. X-linked dominant disorders are generally seen in females. If they occur in males, they are lethal. Affected individuals have a 50% chance of having an affected child. X-linked dominant disorders are less common than X-linked recessive disorders. As we can see in this figure, the father is affected one, mother is unaffected. Father has X and Y chromosome, the X chromosome is affected one, mother is unaffected with the XX chromosome. So this X chromosome with this blue allele is the affected one. Wherever this X chromosome with the blue allele will be passed on, that kid will be the affected one. As we can see, the father can pass on the Y chromosome to the sons. This is the reason the sons are unaffected, whereas the father passes on the X chromosome to the daughters, and this is the reason the daughters are affected. Now, being dominant X-linked condition, here the daughters are affected, not carriers. If this would have been recessive, the daughters would have been carrier. X-linked recessive means different things when we talk about men, and it is completely different when we talk about women. Women have two X chromosomes, so if they inherit a X-linked recessive condition, they usually have a working backup copy of the gene on their other X chromosome. And this is a reason they won't show symptoms in most of the cases, but there are though exceptions for that. And in such a condition, they're called as carriers. Because of this, oftentimes women who are carriers for X-linked recessive condition do not show any symptoms. And as I mentioned, there are exceptions to this. Women who are carriers for X-linked recessive condition and show symptoms usually have much more milder symptoms than are found in men. Women generally would need to have inherited non-working genes from both the parents affected with X-linked recessive condition. Men, however, only have one X chromosome. So if a gene on the X chromosome is faulty, not working properly, they do not have another X chromosome to provide a backup. Because instead of a second X chromosome, what do they have? They have a Y chromosome. Therefore, if a X-linked recessive gene is passed on to a male, they will be affected with that genetic condition. X-linked traits and mutations. As we can see in this table, X-linked recessive and X-linked dominant, the various traits and mutations I explained. We can see X-linked recessive, if the mom is a carrier and dad is a non-carrier, then there are chances of daughter 25% will be non-carrier and 25% will be carrier. Whereas son, 25% again will be non-carrier and 25% will be affected, because though mom was a carrier, the X chromosome, the faulty X chromosome of the mom was passed on to the son, and because the males have only one X chromosome, they get affected, they don't become carrier. The second case wherein the mom is a non-carrier and dad is affected, because the dad is affected with X-linked gene, all the daughters are going to be carrier. In case of recessive, all the daughters are going to be carrier, but in case of dominant, similar case, all the daughters will be affected, because in dominant, even one gene, if one dominant gene is present, they will show symptoms. Over here, each son, all the sons will be non-carrier, and over here all the sons will be non-affected. If we talk about X-linked dominant, wherein the mom is affected and the dad is non-carrier, there will be 50-50% chances, be it daughter or son, they will be affected or non-affected. Now we'll see this inheritance chart to understand the concepts further. As we can see in this chart, X-linked recessive inheritance, wherein the mother is a carrier of the condition and dad does not have the condition. So the mother has two X chromosomes, the dad has X and Y chromosome. This second orange color X chromosome of mother is not working, X chromosome with non-working gene, and rest of the blue color chromosomes, they are working. So dad passes on the X chromosome to the daughters, the Y chromosomes to the son. Mom passes on this blue X chromosome, one to the son, one to the daughter, and this non-working, one to the son and one to the daughter. Because this non-working went to the son, the boy will have the condition. Why? Because it has only one copy of this X chromosome. Therefore, the boy will not be a carrier, he will be affected. Whereas when this goes to the daughter will be a carrier, because she has one more working copy of X chromosome. So in this case, all daughters, they don't have the condition, but 50% daughters, they will be carrier, 50% will not be carrier, whereas 50% of boy, they don't have the condition, and 50% of the sons, they will have the condition. Now taking second case, wherein X-linked, again recessive inheritance, where father has the condition and mom does not have the condition. So over here, mom has XX chromosome and father has XY chromosome. Mom, both the X chromosomes are working fine, and dad, the X, orange color X chromosome, is a chromosome with non-working gene. So father passes on this non-working gene to both the daughters, because the X of the father goes to the daughter and the Y of the father goes to the son, and the Y is a working one. So the sons will not have the condition, but faulty X went to the daughters, so all the daughters will be carriers, but they will not have the condition. Now why both all the daughters will be carriers? Because it is X-linked recessive. Had it been X-linked dominant, both the daughters would have been affected. Now since the mother doesn't have the condition, there's a reason all sons do not have the condition. These are the examples of X-linked recessive disorders: muscular dystrophy, hemophilia, severe combined immune disorder, and some forms of congenital deafness. So few points to keep into mind. X-linked traits generally pass from mom to son. Females must have two X-linked recessive alleles to exhibit a specific disorder. If females have only one X-linked recessive allele that is not working properly, the females will be a carrier. And if the father has X-linked recessive faulty gene, in that case the daughters will be carriers. Coming to autosomal disorder, as we all are aware, as we saw in our last lecture, there are 23 pair of chromosomes in normal human body. So pair of chromosomes from 1 to 22 that are called as autosomes, whereas the 23rd pair of chromosomes, they are called as the sex chromosomes. So autosomal means the gene that is involved is found on one of the first 22 pair of chromosomes, and it does not lie on the X or Y chromosome, that are the sex chromosome. Now again, the autosomal, it is further subdivided into autosomal dominant, autosomal recessive. Dominant refers to the explanation that we have two copies of each gene, one from mom and one from dad. And in order to have an autosomal dominant condition, the person has to have one copy of non-functional gene. So if a person inherits even one copy of non-functional gene from either mom or dad, the person will be affected, and they can inherit this copy from either mom or dad, who may also have the condition. Often the autosomal dominant condition can be seen in multiple generations within the family. If one looks back through their family history, they notice their mother, grandfather, aunt, uncle all had the same condition. And in cases where the autosomal dominant condition does run in the family, the chance for an affected person to have a child with the same condition is 50%, regardless of whether it is a boy or a girl. It is the same 50% chance for each pregnancy. Autosomal dominant disorders are generally transmitted from parent to child through one or more generations, or can result from a new mutation. The disease will typically show a Mendelian pattern of inheritance. That means the males and females are equally affected. Examples of autosomal dominant: albinism, achondroplasia, Huntington disease, polycystic kidney disease, and deafness. Now we'll see this autosomal dominant inheritance pattern wherein the dad has the condition and mom does not have the condition. Now as we can see, dad has X and Y chromosomes and mom has two X chromosomes. So this X chromosome, over here we are not talking about the sex chromosome. Over here we're talking about the rest of the chromosomes apart from the X and Y chromosome. So these are the autosomal chromosomes that we are talking about over here. This is the reason over here X and Y is not in. It can be any chromosome from chromosome number 1 to chromosome number 22. Any chromosome can be there. So let us consider only one out of this pair of chromosome of that is not working properly. It has non-working gene, whereas rest, this chromosome and both the chromosomes of the mother, it has working gene. So father will pass it on to two children, and those two children will have the condition, and rest two children will not have the condition. So we can say 50% of the children will have the condition and 50% of the children do not have the condition. Since it is not the disease that is linked to the sex chromosome. Autosomal means chromosome pair number 1 to 22. Over here we cannot talk that father gives the Y chromosome to son and X chromosome to daughter. So this is a reason, no matter the kids are boys or girls, it will follow a Mendelian pattern. That means the 50% of the children, despite the fact they are male or female, will be affected, and 50% of the children will not be affected. Now coming to autosomal recessive. In order to have recessive condition, a person has to have both copies of a gene that are not working. The copy they inherit from mom is not working, and the copy they inherit from dad is not working, resulting in 0 functioning copies of that gene. With recessive conditions, if you have one copy of the non-working gene, then you become carrier. You do not have the condition and typically do not have any related symptoms. Affected children have parents that possess both a mutant and functioning copy of the allele. Some examples of autosomal recessive diseases: cystic fibrosis, sickle cell anemia, Tay-Sachs, thalassemia, galactosemia, hemochromatosis. Now, it is rare to see any history of autosomal recessive conditions within a family, because if someone is a carrier for one of these conditions, they would have to have a child with someone who is also a carrier for the same condition. That means the mother and father both should be the carriers of the same condition. Only then the child will be suffering with the condition, will be affected with the condition. But this is a very rare case. Most autosomal recessive conditions are individually rare, so the chance that both people are carriers for the same recessive genetic condition are likely low. Even if, let's consider, both the parents are a carrier for the same genetic condition, still there's only a 25% chance that they will both pass down the non-working copy of the gene to the baby, which would lead to the baby having the genetic condition. This chance is the same with each pregnancy, no matter how many children they have with or without the condition. That means also there is a 50% chance the baby would be a carrier just like its parents, and as discussed above, carriers generally do not have any symptoms. There's also a 25% chance that the baby would inherit a working copy of the gene from both parents and not be a carrier. So we can see the inheritance pattern from here, autosomal recessive inheritance pattern, wherein the dad is a carrier and mom is also a carrier, but they are not affected with the condition. Now again, over here we are not talking about X and Y chromosomes. We are talking about chromosome pair number 1 to 22 that are non-sex determining chromosome. They can be any chromosome. So let's consider that has one chromosome that has a gene that is working, mom has one chromosome that has a gene that is working, and both have one chromosome that has a gene that is non-working. So what is the chance over here? That 25% chance child doesn't have condition and is not even a carrier. 50% chance children don't have the condition but are carriers, and a 25% chance that the child has the condition. So overall, if we'll see, there will be a 75% chance children didn't 75% of the chance that the children don't have the condition. Now let's take a look at the autosomal traits and mutation. Autosomal recessive, if both the parents are carriers, 25% condition, 25% non-carrier, 50% carrier. We saw in the previous slide. One parent carrier, one parent not carrier. Each child 50% chance it can be carrier or non-carrier. In case of autosomal dominant, both parents are affected, then each child has the chance 25% being unaffected, 25% more severely affected than parents, or 50% affected. If one parent is affected and one parent unaffected, each child has a chance of being 50% affected and 50% unaffected. We won't see carriers in autosomal dominant. It will be visible only in autosomal recessive, because in dominant gene disorder, even the presence of one gene is enough for the person to be affected with the condition. Then coming to the next type, that is a chromosome disorder. Disorder resulting from changes in the number or structure of the chromosomes. Simple example is Down syndrome, which results from an extra chromosome, number 21. That means instead of two chromosomes, all the chromosomes they come in a pair, one from mom and one from dad. Remember this basic golden rule. But the 21st chromosome comes in a triplet, that is a trisomy. There are 3 copies of chromosome number 21, and that leads to Down syndrome. And this is how the people suffering from Down syndrome they look like. Then coming to the next type of disorder, that is multifactorial disorder. Disorders caused by changes in multiple genes, often in a complex interaction with environmental and lifestyle factors such as diet or cigarette smoke. Many of the most common health conditions such as heart disease, stroke are considered to be multifactorial. This means that there are many things that determine whether or not someone will develop that specific medical condition. Diabetes, for example, is likely caused by a mixture of genetics, lifestyle choices, and environment. However, how much genetics affects someone's risk may vary family to family. For example, if Jay has 3 relatives who have diabetes, his risk may be higher to develop diabetes than Anne, who has no family history of diabetes. With multifactorial conditions, heredity may offer some information as to someone's risk, but it is complex, and our understanding of these health issues is constantly evolving. Some common examples of multifactorial conditions are heart disease, high blood pressure, Alzheimer's, arthritis, diabetes, obesity, cancer, high cholesterol, thyroid disorder, some birth defects such as cleft lip or palate, spina bifida, and heart defects. Thank you.